That means most of the materials, what we learned here, these are the basic materials, which is very commonly we use every single day in our dental practice. So we will try to learn those materials theory. So today, tomorrow, and day after tomorrow, the 3 days lecture will try to cover some basic materials, their name, their properties, their chemical makeup, their advantage, their disadvantages, and how to mix them and how to manipulate them. After getting these informations as a theory, so Monday we're gonna start to use this. We try to mix them by ourselves. This is the way this module will go on. Okay, so let's go to introductions.
Sir, about the box that you're gonna show us about the materials, the tools. You're gonna show it after class, like end of the class,
What do you mean? What is that?
for the box, for the instrument that we took yesterday.
What do you want me to show?
You said you're gonna show the box, the example of the box. We can buy it.
I think I don't say anything like that. You misunderstand something.
So she's trying to mean yesterday you were saying that some of your students went back, bought a box for you had told us to show us a sample box for which we can buy to keep our products not to get
Oh,
to
okay.
break
The
and stuff like
box.
that.
Okay. Whole you box.
Sorry. Thank you,
No, it's
Shamim.
okay. It's okay. I understand. So, this is like, do I have the picture? Mm. Mhm. Okay, so I don't see any picture right now here. So don't worry, just I think next Wednesday probably my previous class will come. They will come with their box so that you are also there on next Wednesday for practical class. So that time you can see, okay, then you can buy. It's
Okay,
like,
thank you.
uh, this is a little bit big, not a small box. Anyway, so just wait because this is not so important, okay? Because on next Monday you are just coming with the YOLO box, only the typodont.
Okay, thank you.
YOLO box means the typodont, which is the model. And that is your patient actually. That is the right now you don't have any
Yeah,
patient.
our patient.
That is your patient. So just wait for that buying the box, which we will put all the materials what you received so that it will not dislodge. That is important. But at this moment, I don't have that picture, but I can show you physically when the other students when they bring it on next Wednesday
Okay,
probably.
thank you.
So, dental materials module where you will try to learn uh, all the materials, which is all basic materials. You know that it's a science which is continuously improving in every single day. Day by day, this the science is developing. So this course is designed to develop our clinical understanding of the properties. Properties means what are the exceptional properties the materials has, whether it is good for teeth, which teeth, anterior teeth or posterior teeth, whether it is good for in the dry environment or moist environment, something like that. Manipulation means to mixing, how to mix them and use of dental materials. So properties, manipulations, mixings the materials is the in a clinic and laboratory settings. So there are some materials which is only we use in the dental clinic, and there are some materials where we use it on the dental laboratory. So the students will be provided with a lab component to demonstrate competency in their critical applications or theory, and students will learn about the various materials and products used in the dental field. That is the main goal for this module. So this module will focus the materials, which is basic materials. If you know the basic materials, how to use them, how to mix them, and what is the name of these materials, and what is their chemistry behind it, what is the properties behind it, and that will be your first step to learn. Second step, practically, hands-on. You have to mix those materials. And this is the way you will develop a skill about the dental materials. Because till now, whatever you learn, if you look at your topics, such as you learn about dental anatomy, you learn about infection control procedures, you learn about the pharmacology. This is all about the basic things regarding the dental clinic environments. Now you are trying to learn something about the materials, which is each and every single day you will commonly use these materials. You prepare the materials for your dentist, and dentist will apply through the instruments. So our next module will be the instruments. So materials and instruments, they are all back to back. So your next module is the operative dentistry, where you will learn about the dental materials, how to transfer to the dental surgeons, and as well as what are the dental instruments we use to mix the materials. So that's why these two module is back to back. So in this field, we will learn about, if you see here, we will learn about something. Let me go up a little bit. Yeah, so first of all, the restorative materials, restorative and aesthetic dental materials. Restorative means, what is the meaning of restoration? Restoration means to bring back the function of the teeth which has a cavity. The teeth which has cavity or caries, that means bacteria destroy the tooth structures, which already you know how bacteria destroy the tooth structures. And after bacterial attack, when the tooth structure is lost due to the demineralizations, and the remineralization is not enough, in that situations, cavitation will form. And that cavitations, we need to fill it up with the materials to bring the function of the teeth. That is called the restorations. It can be direct restorations, it can be indirect restorations. Direct restoration means, say, as for example, you have cavity, you just go one dental office, and they give you some materials on your hole, on the top of your hole, and fill the holes, and then you come back. That is called the direct restoration. There is same sitting. But sometimes you go to the dental office, but they don't give you the restorations immediately. They will take the impressions, they will prepare the tooth, they will take the impressions, they send it back to the laboratory, and the laboratory will made it, and they will send it to you back again, and you go again in the dental office. So that is called the indirect restorations. So anesthetic materials means there are sometimes some materials we need to apply on the tooth surface to make them more white, like whitening materials. Some people, they don't satisfied about their tooth color. They come to the dental office, and we do some bleaching. We do some, the color change. So, or we try also dental testing one. The teeth become amber color, or the enamel is cracked. So in that case, we can go for the veneer. Okay, this is another way we can improve the patient's appearance. Then we will try to learn something about the base materials, dental liner and base materials, because we know that inside the tooth what we have. Do you know inside the tooth what we have, which carry our nerve sensations? What is the part of the tooth which is related with the blood vessels and nerve fibers? Anybody in the class?
It's pulp.
This pulp, very good. So the pulp is the one which is, we need to protect them. While we are doing the restorations, we need to protect our pulp. And to protecting our pulp, we need to apply some accessory or supplementary materials before we apply the filling materials. So this pulp protecting materials are lining materials or base materials. Calcium hydroxide, zinc oxide eugenol, zinc phosphate, zinc polycarboxylate, a glass ionomer, resin modified glass ionomer. So these are the some examples of lining materials and base materials which we apply. And the bonding system. Bonding system is the another way, like how they bond. So you know that the tooth and this material, they're artificial materials. So these materials and the tooth is a natural grow part in our body. So the tooth materials and this the dental materials, how they mix, how they attach together, that is called the bonding system. We have three type of bonding. One is chemical bond, one is a mechanical bond, one is a micro mechanical bond. In the last time, I think I forgot the group name. They talk about the Pitts and Fisher sealants. So when they apply the acid, phosphoric acid, 37% phosphoric acid, they mention that the tooth become frosty white in appearance. That means tooth become rough. And this rough surface create the mechanical bonding between the tooth and the materials. Another one is the chemical, that is that they will be reacting with the chemical, that is glass ionomer. And another one is like a micro mechanical and mechanical, and another one is mechanical bonding. So we'll talk about those things during this whole discussions. And the last two is the impression materials and the laboratory materials. Impression materials means like sometimes it is not possible to make the restorations immediately. So we have to take the measurement of the patient's mouth. By applying some materials in the mouth, we will get all the teeth and we make the model. So once we are applying the materials to get all the tooth impressions, that is called the impression materials. So impression is the negative reproductions of the tooth and its supporting structures. And after the impressions, we need to pour them. We need to fill it up with another materials. We call them the laboratory or model materials to get the positive reproductions of the tooth and its supporting structures. So that actually the laboratory materials. So these are the materials we will try to cover in this, the whole process. If you go for the method of evaluations, you can see here the method of evaluation is here. Like you have quizzes, you have final exams, you have practical competencies, and definitely your attendance, your interactions with the instructors is about 10%. So as you can see here, the theory is more here, 70% mark carry the final exam. So you have to be very careful about the theory, what you are learning here. And the passing mark for this class is about 60%. So 60% is the passing mark for the final exam, and you have to get 60% individually in the final exams. That is the method of evaluations. So that is pretty much an outline regarding your syllabus, what you are going to learn, which I mentioned it before that before we start, we need to get some idea what exactly we're going to learn, and that will help us to map out where we are going and which directions we are going. And as you know that for the practical class, which also I discussed yesterday, that we need to prepare ourselves, and that will be our the individual preparations. And next week, Monday and Wednesday. So from starting from the next week, every Monday and Wednesday, we will be in what you call like the in person for practical class. And regarding the division of the class and all other timetables, that is not finalized yet. I'm waiting for that. Once I get it, I will inform you immediately. Now let's talk about the today's topics. So let's go to the pages sections. And today we will try to focus about the basic informations regarding the restorative materials. The restorative materials and the aesthetic materials. According to our textbook, in chapter 43. So let's talk about this chapter. what exactly we need to learn from here. Okay. First of all, this is the one where we are going to learn about restorative and aesthetic dental materials. So restorative, as I mentioned, that this will be used for to prepare the tooth or to bring back the function of the tooth. Either we will go for a indirect restorations or direct restorations. Yes, go ahead, Carmen.
Teacher, I can't find this PowerPoint on Canvas.
What about other students?
Me too.
Everybody same?
Yes.
They cannot see.
Okay, let me show you here. If you go like this, let me go back here. As you can see here, are you able to see my screen, right?
Yes.
Okay. So you first of all, you come to the pages sections on your site, then view all pages, click view all pages. Then you can see day 1, 2, 4, all like that. And I just click it here and it will be download, something like that. Can anybody share your screen? I can see the problem. Let me turn off my one.
Let me see if I can share it. Okay.
Yeah, requesting alone. Okay.
Yeah,
Is
it's
it the who is sharing this one?
Carmen.
Okay, Carmen, go back to the day 1. Go to the view pages. Okay, so now you can click the day 1. Okay, this page part of the module week 1 has not been unlocked yet.
We need the same.
And everybody get the same?
Yes.
Yes, it's same for me.
Yes, mine is the same.
Right. Okay, just give me 1 second. I want the less complaint, but the complaints are coming one by one.
I'm tracking all of them. It
Yeah,
says
yeah, it's okay. So can you check day 5 or same thing?
the same thing.
Best time since 2003. You have reached our Scarborough campus. If you know your party's extension, please enter it now. For campus information, press 1. For student services, press 2. For student financial services, press 3. For career services, press 4. Transferring your call. Good morning, Mr. Zama.
Good morning. How are you? Okay, I'm fine. You know what? From today we started our module like what do you call like dental materials. Okay, DADM 106. So the students got the invitations, but they are unable to open their pages like the study materials. And yeah, so it shows that like it is not been unlocked. So could you please do this one, or I need to talk to the cameras? Because Neha did it before, like with me. Okay, thank you very much. So can you please do this one? Yeah, okay. So please make sure that they are waiting for that. Okay. Okay, so hopefully you guys will able to see. Just turn off your sharing. And in the meanwhile, just follow the lectures. And if you want to make the note it by yourself with paper. No? Okay. So now the restorative materials. What are the restorative materials? As you can see here, the restorative and aesthetic dental materials most often used today. What are the name? So first thing, you have to know the name. Everybody should memorize the name. Amalgam, composite resin, glass ionomer. In short, we call them the GI. Composite resin, we call them the CR in short. Then the temporary restorative materials, we call them the IRM. Then tooth whitening products, such as the peroxide materials, gold alloy, and the ceramic casting materials. So these are the materials, the name of these materials which we use for a restoration purposes and as well as the aesthetic purposes. Especially the tooth whitening product, which is mainly used for the aesthetic purposes.